Hello, Scottsdale moms. My name is Kate Eschbach, and I'm so glad that you are tuning in for a special interview with Dr. Kertz today. Dr. Kertz, why don't you tell us a little bit about yourself and what you do in the area for us?
All right, I'm Dr. Sarah Kertz. I'm a pediatrician. I did microbiology first for about a year, but I did residency here at St. Joe's, and I've been here ever since. So I love the area. Chose to come here for residency. So now I work at Phoenix Children's.
That's wonderful. That's wonderful. Well, we're very thankful for your time today that you're going to go over these with us, because this is a topic that I know many moms, including myself, have had to talk about, even though that's not something that we really prepared for when we were expecting our first kiddos. Today, we're going to be talking about constipation. And Dr. Kertz, the first question we have for you is, what is normal in terms of pooping? Could you provide some insight on that?
It sometimes depends on who you talk to, but in general, most people would agree 2 poops a week is constipation. Some would even say 3 times a week. But there's different case scenarios. I'll have some kids that poop every day, but it's hardball poops. And on those kids, I would consider that constipation.
Good to know. Good to know. As a follow-up to that, several patients have asked, what is constipation?
It's a myriad of things for different people. So it can be painful stooling, hard stools. Frequently we hear it was hard to flush. We were scared to flush it. That's a big one for Arizona. Not pooping often. And then withholding stool, because if especially for a kid, if it hurt to poop last time, there is no incentive for me to poop this time.
Right.
And then the poop gets drier and drier, and it gets worse and worse. So the 2 to 3 times a week pooping is probably not enough. We're supposed to poop 1 to 2 soft stools a day. So that's usually our goal with constipation management. And people are always freaked out by that. And I'm like, that's normal.
That is good to know, because I have 5 kiddos, so I feel safe saying this because I don't think anyone can pick out, one of them, but one of them was a withholder. And so it would get very, very, well, first of all, it was painful. So they didn't want to go again, which made it worse. Yeah. And so I'm really thankful that you're telling us about it, because I felt like nobody was talking about this when we were.
Right, and it's a lot of suffering out there, and we almost always get it as, they're here for something else, knee sprain. Oh, by the way, they had really hard poop yesterday, and it turns out, it's been like this for 3 years, and people barely ever want to come in just for that, because I'm sure it's embarrassing for them, for the kid. But it really is a 20 to 30 minute discussion with the pediatrician, and I do recommend it because it's lifestyle changes that we're looking at.
Amazing. And I found that, being in Arizona, for us, a lot of it had to do with like hydration. And especially when they started school, they just weren't drinking as much as they were at home, and they weren't drinking enough. Do you find that to be the case a lot of times?
Yeah, you're totally right. I would say that's number 1 for Arizona, because I've worked, I traveled for rotations, and I never ran into constipation like this. So when I got here, then I did separate, medical education credits for constipation, because it really needs to be addressed here. And water's a big one. It's great when they're at home and you can chase them around, but at school,
you give them their water bottles and make sure they're drinking. And
right, my kids will come home, and my oldest, I'm like, he drank this much. It's like, I drank today. I'm like, that was literally an ounce and a half.
Yeah, you're like, you took a sip. That's not a drink. Like, what is that? Oh, that's good to know. Okay, so treatment options with medication and without medication. What are your recommendations?
I definitely like without. So I save the medicines for worst case scenario, or if a child just psychologically is really having a lot of issues with it. The biggest one is, like you said, it's the water. We got to drink more water. And so for kids, I usually mark out how many ounces I want them to drink a day. So, the average sort of teenager, I'd be like, you need 3 to 4 water bottles by the end of school. And those are like 16-ounce water bottles. And that gives them a perspective. I'm like, that doesn't include you doing sports, doesn't include when you come home.
Right.
And diet is the next biggest thing. So
really, okay.
Half our plate should be fruits and veggies, and then your meat and your grain. But and that major part of that half should be mostly veggies. So I know that's a big issue for everybody for the most part, but we focus on just slowly increasing it, getting kids involved with cooking and growing their own food, and hands-on stuff and baby steps. I'm living proof you can change your diet. So they did a study with toddlers, and they realized 10 to 20 times of saying yuck before you can actually say yuck. And then they said, you know what, let's see if we can change an adult's palate. And the same thing happened. You can change an adult's palate. And I'm a much better eater than I ever was. I didn't want picky kids, so I fed them everything like tofu, seaweed, how do you cook eggplant, you know, all that. So that is the biggest thing. And then there's temporary measures that we'll do to get a kid comfortable, because obviously if a kid's not used to eating fruits and veggies, you're not going to change that tomorrow. So the temporary things would be things like juice, anything that starts with the letter P, pear, pineapple, papaya, prune. I otherwise would
love that. Okay. I love ways that you remember things.
Yes, it has fructose that helps the gut move this way. All juices help draw water into the intestine, but the ones with the fructose help out a lot. And normally I would hate juice, terrible for the teeth. You tend to not eat veggies if you eat juice, but it's a quick, nice way, other than enemas and stuff, to get the gut moving. And then it depends on age. Like for infants, sometimes, you know, if I have a 9-month-old with hardball poops, if they're formula fed, I'll use pear juice for 1 or 2 bottles a day to mix with the formula while we're working on dietary changes. And most infants and stuff will take prunes, which work great. Those are great ways to work at, and temporary measures if you have to do medication. And this is really for kids having encopresis, where, you know, the colon's so stretched out, the nerves don't work, and then poop is escaping, and parents yell at the kids, and I'm like, it's normal. They literally cannot control it. And so it takes some time to shrink that gut back down so that they're not having those accidents. So on those kids, I'll use Marilax polyethylene glycol. So it works as a laxative, but it's not. So it's not really addicting, as opposed to like Dulcolax sometimes we'll have to use, and Colace, those your body sort of gets used to. But Marilax, for the most part, your body doesn't get used to, and it's like an osmotic load. So it helps draw water into the intestine, so it makes it easier to poop. So on those kids, we'll try to aim for a clean out. There's nicer ways for a clean out and not so friendly ways. So that just depends on the family and the child, and are they going to school? Because those medications, they work from 6 hours to 3 days. So it's a little bit hard to predict and hard to find out what is their perfect dose. Is it a teaspoon a day? Is it a capful a day? But I'll use those medications, depending on the history, if we really need to get a clean out. Because obviously an 8-year-old pooping in his pants at school is embarrassing. Kids can smell it. And then you don't want to have that label. And that psychologically, obviously they feel like something's wrong with my body. I'm pooping, it's embarrassing. I'm not even potty trained. And I try to explain to kids it's common. This is what we do to fix it. And they usually get on board because they don't want to poop their pants, obviously.
Yeah, and that's good to know. So it has nothing to do with their control at that point. By then,
Right.
it's like, it's just happening. That's
Right,
good
right.
to know. Yeah. Oh my goodness. When it is constipation, is it a sign of something worse going on than just constipation?
The history is really important, which is why a lot of these visits take a long time, because officially you need to start with, did this child poop within the first 24 hours of life? Because if you didn't poop in the first 24 hours of life, it's a big red flag for, at the beginning, cystic fibrosis. Is your gut not built correctly? There's something called Hirschsprung's, which you lose, it's a genetic thing. It's a loss of nerve cells in the gut, and you get ribbon stool because you have a really narrow piece of your colon. So those kids will have a history of, they didn't poop in the first 24 hours of life. So you have to go way back then for that history. For infants, we worry about botulism, which is rare, but I've seen it twice, which is probably too much. And that's almost all the time from honey. You can get it from some foods, but it's giving honey to, an infant under 12 months. So there's that warning label on honey now. But those kids come in, with a history of constipation, yes, but then they're more drooling, they're floppy. For older kids, new constipation, like it's just been 2 weeks and I've never had this before. That worries me, that other than, something changed, like I traveled is a big one. That can cause constipation for kids, but you have to look at neurological issues, and you think of the worst things, a mass in the area, so you have to ask about urine stuff. So those would be the big flags I would worry about, which is fortunately unusual, but you don't want to miss that.
Yeah, no, that's good. So the moral of the story is stay hydrated,
Yes.
talk to your pediatrician, do not be embarrassed. Go ahead and ask all the questions and get in front of it when you can.
Yeah, there's something you can do about it. So you don't have to
That's
live that
awesome.
way.
That's awesome. That's good to know. Well, I think that's all the time we have for today, but Dr. Kertz, thank you so much for taking the time to answer these questions for our audience. And thank you to everyone, all the moms out there that submitted questions. These were great. We will be publishing a recap of this interview for everyone to reference on our website. So keep an eye out for that. And in the meantime, if you know a mom struggling with her kiddos with constipation, share this with them so they can know as well. Thank you, Dr.
Thanks for
Kurtz.
having me.
Thank you.